Hello, I'm Isabel Sider. For my interview project, I interviewed Dr. Susan Schumann. She has her PsyD in clinical counseling with a focus on child and adolescents, specifically with autism. When asking her if she always wanted to enter this career field, she said that she had always been interested in it, but it wasn't until her freshman year of undergrad that her roommate, who also was a childhood friend of hers, was diagnosed with bipolar disorder. And watching her roommate go through that and being able to be there and support her through that was what really inspired her and motivated her to enter this career field to be able to help other people with their mental illnesses. The characteristics that Dr. Schumann mentioned being important for someone working in this field were patience, open-mindedness, and being a good listener. And we were discussing how, especially nowadays in today's society, being able to talk to someone and know that they're not judging you and they're not letting their own personal opinion affect how they treat you is not as common as it should be. And so as a therapist or a psychologist, it's really important that those characteristics really are seen in the client's eyes. And so those were a couple of the things that she thought were really important. One of the biggest challenges for her personally, she was saying, she works with kids. And so oftentimes parents are a big part of their therapy and treatment and part of their progress. And so she said a lot of times parents either one, don't want to accept or don't believe that they can actually be part of the problem in their kids and whatever their kids are in therapy for. And so really working with parents to understand that they're going to have to change some of their behaviors in order to help their kids in their therapy. And also parents sometimes expecting Dr. Schumann to fix their kids in therapy without them as the parents having to do any additional work. And so she said parents struggle and are sometimes harder to work with than her clients, and that she has to teach them how to help their kids outside of therapy and how to change those things at home or at school or wherever they're struggling. The parents have to take responsibility for that as well. Her favorite part of her job is seeing growth and progress in her clients. She always feels sad to see them go, but she knows that ultimately, like, that's the goal, is that they don't need to be coming to therapy as often or at all. And so she said, it's sad when a client is at that point that they can go live a healthy, safe life, but she does still wonder about how they're doing and their progress and that kind of stuff. This was really an interesting topic for me to discuss with her, the benefits of her education and her program. She said one of the benefits was being able to complete her master's along the way to her doctorate. So she did a dual program where her 4 years of classes included her master's degree along the way. So she did 4 years of classes, a year of internship, and then she graduated with her doctorate. And then she had 1 more year of postdoc observation. She was in a clinically based program rather than a research. She still did her dissertation and did research, but she said she got a lot of opportunities to work in the field while she was in school, which she thought was really beneficial. One of the downfalls that she mentioned was she didn't feel that the people educating her made enough of an emphasis on self-care for therapists. So she said it was really hard, especially once she was out of school and had her degree, being able to take a self-care day or, reschedule with clients if she was physically sick or just not in a mental headspace to really be there for her clients. And so for a long time, she would just go into work and she would meet with those clients regardless. she said, looking back now, she knows that she probably wasn't benefiting her clients as much as she could have or as much as they needed her to, because she wasn't in a place, whether it's physically or mentally, to be doing it that day. And so she has said now she knows when it would be better for her to take a day and recover, whether it's to clean the house or take care of her kids or just not go to work that day. And I told her that I feel in my education and where I'm at, they've done a lot better job at emphasizing the importance of self-care for people working in this field, because it can be mentally draining to hear everybody else's struggles when if you can't address your own, then it's going to get in the way of being able to help them as clients. And then one of my personal questions for Dr. Schumann was why she decided to pursue a doctorate degree instead of just a master's degree. And her two main reasons were she basically was told or was given the impression that there were only so many jobs you could do with a master's degree and that your career options were limited unless you had your doctorate. And she said the more that she learned about career options, she wanted to be able to do testing and assessments. And she knew she needed her doctorate for that. So she actually is now trained through the Thompson Center with the Echo Autism Project, and most of her work and her clients are doing diagnostic testing for autism on kids. So I think overall, Dr. Schumann is doing a lot of what I want to do as far as working with kids, working with parents on how to help their kids. And she seems, she says over and over that she loves her job. She wouldn't trade it for anything. And kind of was on a similar path. She always knew she wanted to work with kids, and that's kind of where I've been for the majority of my undergrad and now in my grad and grad school. I know that that's the population I want to work with. And so hearing her insight to all of this was really helpful.